undergraduate nurses, my name is Crystal and I am a registered nurse. I have a master's degree in nursing education and have been a nurse for over 13 years. I have bedside experience as well as teaching students at the undergraduate level. I am a nursing content developer for the Princeton Review, and today I would like to talk to you about the NCLEX exam. First of all, congratulations on graduating nursing school. You are probably so excited that you are one step closer to becoming a registered nurse. You are also probably terrified of that last step, taking the NCLEX, the test that will officially start your nursing career. The weeks leading up to the NCLEX are stressful. How can you possibly remember everything you learned in nursing school? The NCLEX-RN exam content is broken down into 4 major categories: safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. 2 of these categories are further broken down into subcategories, including one with the heaviest percentage of items, management of care. So how do you study for each of these categories? Let's examine the top 5 concepts to know when studying a disease process. Let's take COPD for example. COPD, or chronic obstructive pulmonary disease, is a very complex disease process with many physical changes, treatment options, and interprofessional care. When faced with an NCLEX question regarding COPD, take a moment to mentally tap into your knowledge bank. What are the top 5 things to know when answering a question regarding COPD? Number 1, patho. Pathophysiology was one of the first courses we took in nursing school. It is also one of the most important aspects of a disease process. So what is happening inside of the body with COPD? We know that COPD is characterized by chronic inflammation of the airways, decreased lung elasticity, and destruction of the alveoli. If our airways are swollen, that decreases the diameter in which air can travel through. If our lungs lose elasticity, they can't expand properly. And if our alveoli are destroyed, we can't have gas exchange. Understanding the patho of COPD can help us understand the next concept. Number 2, assessment. Health assessment is a vital tool when taking care of clients. What physical changes are we going to see in a client with COPD? We know that airways have a decreased diameter due to chronic inflammation, so auscultation will result in wheezing. If our lungs cannot expand properly, you will notice rapid and shallow respirations. Destruction of the alveoli leads to decreased gas exchange, causing chronic hypoxemia characterized by clubbing, cyanosis, and low oxygen levels. Knowing what abnormal findings you can expect, you can tackle the next big category. Number 3, pharmacology. There are tons of medications that you will be administering as a nurse. When studying for the NCLEX, patho will be your home base. What medications can treat COPD? We mentioned that COPD causes chronic inflammation of the airways with a decreased diameter for airflow. So it only makes sense that one of the main category of medications to treat COPD are bronchodilators. We need to get those airways open to allow air in. And how do we treat inflammation? You guessed it, anti-inflammatories. Now that you have an idea of what will treat it, what will you do as a nurse? Number 4, skills and interventions. Again, go back to your home base, patho. Think of interventions that will help or correct the abnormal physical findings. If the lungs cannot expand, which position helps the client breathe better? If we have decreased gas exchange and cyanosis, don't forget about maintaining an open airway and facilitating breathing by applying prescribed oxygen. Number 5, education. As a nurse, you are an educator. You educate clients on the disease process, medications, the plan of care. It is important to always be prepared to educate. If a client has COPD, what are you educating on? How do we stop the progression of COPD? Smoking causes inflammation of the airways, so smoking cessation is key. How do we get the lungs to expand? Teach that incentive spirometer and educate your client on how to manage their disease. Let's do a quick recap of the concepts as they apply to COPD. Number 1, it causes inflammation of the airways, decreased lung elasticity, and decreased gas exchange. Number 2, it results in wheezing, tachypnea, cyanosis, and clubbing. Number 3, we treat it with bronchodilators and anti-inflammatories. Number 4, we help by positioning the client in high Fowlers and administering oxygen. Number 5, we teach about smoking cessation, incentive spirometry, and deep breathing exercises. By taking the time to review these 5 concepts, you will be prepared to answer those NCLEX questions that may seem overwhelming at first. Ready to practice what you've been studying? The Princeton Review offers practice questions in every NCLEX category, created by nurse educators such as myself, who have experience at the bedside and in the classroom. The practice questions offer you rationales to help you understand why the answer is the best choice. So continue studying for the NCLEX and let the Princeton Review help you achieve that final step before becoming a registered nurse.